Assalamualaikum everyone, welcome back to this channel. This is me Alia Wahid and you are on the channel of Medicare. So as you know that we have started the chapter of pathology, and in which we are studying the introduction of pathology, that we see the common terms that are defining it, like the etiology, like prognosis, uh, pathogenesis, like treatment, cure, and prevention. What is a patient? What is a lesion? We have studied these kind of terminology, like epidemiology. What is a pathologist? And in the next, we have seen what is a disease and what is the classification of it. We have classified into 7 type: idiopathic, in which we don't know the cause of it, like the metastasis of breast cancer, the pulmonary fibrosis, and the Parkinson disease. Similarly, second is the inflammatory disease, in which we have studied the inflammation occur, inflammatory bowel disease, ulcer, hepatitis, and these like diseases. Then we have studied next disease, which is about our congenital or developmental disease, which occur from the birth, and the reason behind is the genetic changes, like examples which are thalassemia, sickle cell anemia, and Down syndrome. Then the next was acquired diseases which occur after the birth, and they can be infectious or non-infectious due to environmental factor, lifestyle, and poor diet. The examples are like hepatitis C, AIDS, cancer, heart diseases, and these like diseases occur in it, arthritis. And then the next disease that we have studied in the previous lecture was about metabolic disorders, which are occur due to changes in the metabolism of our body. Like the diseases included in it are like you should know, like the adrenal disease, Addison disease, Cushing disease, hyperthyroidism, hypothyroidism, hypercholesterolemia, and diabetes mellitus, diabetes type 1, type 2, and gestational diabetes also. So we have studied all of them. Then now we are moving toward our next the remaining type was degenerative disease, in which degeneration occur, like the arthritis, rheumatoid arthritis, osteoporosis, myasthenia gravis are the example of it. Then after revising the previous one, I hope that you have also revised the previous chapter that we have learned about it. Now we are going to start the cellular response to stress or noxious stimuli. That whenever a stress occurs on your cell, whenever any kind of stimuli comes, how your cell do, what kind of behavior it do, it cause the cellular injury. So how the cellular injury is going to occur, and what are the types of cell injury, like the reversible or irreversible injury. So we are going to study what is adaptation. So we are going to study these important terms that will repeat in the whole pathology. So first we discuss the cellular response in the normal state. So homeostasis is a normal state of a cell. This is a steady state, intracellular state, in which we are in our normal physiological parameters. So whenever your body or your cell is in a steady state, is in a normal physiology state, it means it maintains its homeostasis. But whenever a stress came, whenever a stimuli came, or whenever you undergo a process of pathological process, in which any kind of injury, any kind of infection occur to you, then the cellular injury occurs. So this is our normal cell. When we do stress on it, like we apply the physiological stress, it undergo a process which called as adaptation. So if I give you the example of a stress, like if a person who has the disease and whose BP is rising again and again, so what will occurs to his body? So actually the adaptations occur. So like in a person who has the high blood pressure, his heart cells undergo adaptation. The cells of his heart become increase their size, and the hypertrophy will occur. So always remember, hypertrophy is an adaptive response which is given by your cell in response to a physiological stress. And what was the stress? Rising again and again the BP. So BP is the blood pressure. So hypertrophy will occur, which is the increase in the size of the cell. So now your heart cells, because they have to fulfill the demand of your body, so they adapt themselves, they change themselves, they increase the size of the cell so that they can perform their function very well, and they can fulfill the demands of our body. So whenever a pathological conditions occur, like infection occurs, like some injury or some kind of stimuli came to your body, your cell undergo a process which is called a injury. So this is a severe, progressive, rapid onset of your body, that whenever cell cannot bear that infection or injury, cannot adapt itself, so the cellular injury comes. Sometimes the adaptation is become so excessively do that body now become unable to adapt itself, so it also undergo a process which called the cellular injury. Because now like if I give you the example, so in a person whose BP is rising again and again, and he or she is not taking the medicine of it, so what will occur, his body or his first of all, within a few months his body or his heart cell became to increase their size, but they will fulfill the demands of the body, because the body has the ability to adapt but keep our body stable. But after so many years, if he or she is not taking care of herself or not taking the medication, then his body will now the body or his heart cell is not being able to adapt itself, they became cellular injured. Or this injury can be reversible or irreversible of both types. If it has the irreversible injury, it means the body now cannot compensate itself, now the body has given upon it. So if the irreversible injury occurs, now the cell undergo a process which can be necrosis or apoptosis. So necrosis is the cellular death in which cell undergo the death process, and in the apoptosis, this is the programmed cell death in which the cell program is dead, because now the cell decide itself that now I am going to die. So he apoptoses itself, he digests its own self. So always remember, here I have written a note that the cellular death can be normal physiological process or not always harmful. We always see that whenever a cell dies, it means it's a harmful response, it means something dangerous happened to him. But it doesn't right anyway, because sometimes the cell die because to keep our physiology normal. So if I give you the example, like in the stage of embryogenesis means establishing the embryo. So in a pregnant woman, whenever she got the pregnant, so her body began to adapt the body. Now in the uterus the cells became hypertrophic or hyperplasia. Why? Because they have to establish or they have to bear the weight of the embryo there, the weight of the fetus there, so that the body begin to adapt itself, and this is a good process. This hypertrophy is now not harmful for us, actually it is beneficial for us now. So that's why you cannot say that cellular death is always a pathological condition, it can be normal physiology. And sometimes the reversible injury occurs, in which your cell return back to the normal state. Sometimes cells cannot reverse backward in the case of irreversible, but in the case of reversible injuries, your cell cannot can return to its normal size, can return back to its normal size, and now the body can compensate. So this injury occurs when when not much more time is spent on prolonging the disease. So then the irreversible injury can reverse itself. Now we see what is adaptation and what are the adaptive responses. So adaptation, the definition of it, that achieving a new state, achieving a new cell size, preserving the viability and the function of the cell. So if I explain to you in Urdu, so it is that कि सेल अपने आप को एक नए स्टेट में ले आता है, एक नए साइज़ में ले आता है, ताकि उस सेल का फंक्शन वही रहे जो पहले था. लाइक हार्ट का अगर फंक्शन था पंप करना, तो उसने तो हमारे एडेप्टेशन में क्या हुआ, उसका साइज़ बड़ा हुआ, ताकि वो अपना फंक्शन सही तरह से परफॉर्म कर सके, उसका फंक्शन यही रहे कि वो अच्छी तरह से पंप कर सके. दिस इज़ कॉल्ड अडेप्टेशन. एंड योर अडेप्टिव रिस्पॉन्सेज आर ऑफ 4 types. First is hypertrophy, in which the size of your cell is increased. Second is hypoplasia, in which your cells production is very increased. Like in the case of pregnancy, your mammary gland increase their production because they have to produce the milk for it. And in the hypertrophy occurs when you have the high blood pressure and your heart cells increase their size. Atrophy is the reduction in the size. Cell are going to reduce their size. Like the muscle atrophy occur when you don't move your muscle, when your muscle become immobilized. So in a patient who is paralyzed, and if he don't move his muscles, so his muscles become immobilized or muscle atrophy can occur, so his cell size become decreased. Then the 4th type is betaplasia, in which reversible replacement of one differentiated cell type with the another cell type. So this metaplasia means that the cell replace themselves. They change their cell shape and they replace, and they become from one type of the cell, they change their type to the other. Like if I give you the example, in case of smoking induced metaplasia, due to smoking, metaplasia can occur in your respiratory tract. Like how it occurs in your normal ciliated columnar epithelium. These cells are present in your respiratory tract, in which your epithelial structure is like that, columnar. This is the columnar epithelium of your respiratory tract. Okay, and it is ciliated. It has the cilia all over it. Small hair-like projections are called the cilia. Okay, so now if this patient start doing the smoking, this is the respiratory tract of that patient. Now if this patient start the smoking, what will happen? Their cell size change itself. So they change their shape into squamous epithelium, which is like that. So they change their shape towards this line. The whole cell is going to be changed, their shape is changed, their size is changed, their whole nature is changed, their cilia will be removed out because of smoking. So that's why the smoking is so dangerous for you. Now you can see here that your normal ciliated columnar epithelium changed to squamous epithelium due to this reason. So this occurs when a patient do the smoking and the metaplasia occur within her respiratory tract. Okay, so we have seen what is adaptation, what are the adaptive responses. Now we move to the next page. Okay, so the next thing is the example of cellular injury, like the myocardial cellular response to stimuli or cells. So this is a normal myocardial cell. Now if it first of all the stress occur upon it, or the stimuli I gave upon it, it become the hypertrophic cell. It adapts itself in response to the high load or pressure. It became narrow, or where it's increase the cell size. Now if we further increase the demand, it cannot survive, it undergo a process of cellular injury. So injury occur because of decrease the blood flow, or the ischemia occur. So 2 types of injury can occur, reversible or irreversible. Reversible occur when we have the mild stress. Irreversible occur when we have the prolonged stress and the cell will die at the end. So the reversible or irreversible injury depends upon the nature of the injury or the severity of it. Then the nutritious supply of that person, that the person is taking, what kind of diet, what is his nutrition, the metabolism of that person, the body health and the body immunity of that person depends upon it. So this was all about our today's lecture. I hope that you understand it, and if you like this video, then please subscribe to my channel, press the bell icon so that you can get the notification of all the videos that I have uploaded. Thank you so much. Meet you soon in the next lecture with the next topic. Take care. Allah Hafiz.